And then moving on to our fourth question, now we've got new nurse's notes and vital signs from 12:15. So let me look at my nurse's note here. All right, client returned from CT scan and asked to use the bathroom. So he just got this CT, now he's come back to the room. He had one small, brown, loose stool with streaks of bright red blood. We assisted him back to bed. He reported that moving around and using the bathroom made his pain worse. It's now 8 out of 10 in severity. He is diaphoretic, nauseous, he's guarding his lower abdomen, and he's asking for pain medicine. So we give him an emesis basin, page the healthcare provider, and we're awaiting new orders. And because we're a good nurse, we also got a new set of vital signs because he had this change in his status. And we see that now he's very febrile at 100.8. His pulse is even higher. His respiration's a little bit higher, his blood pressure a little bit higher, but mostly the same. And then his pulse oximetry reading about the same. So remember, keeping our picture in mind, this elderly man now having severe abdominal pain, and he looks sick. In this description, he's diaphoretic, he's guarding his lower abdomen, he's holding an emesis basin. This is a very sick picture of a client with this severe abdominal pain. So keep that in mind. Now we are asked for each potential order, click to specify whether the potential order is anticipated or not anticipated for the client. And so if we've got all of these things going on, pain, nausea, we want to treat the pain and we want to prevent any further fluid losses from vomiting, and we want to relieve his nausea and also make sure nothing worse is going on. But of course, we've paged the healthcare provider and they're going to hopefully come assess this client. So let's take these one at a time. As far as starting a clear liquid diet, when you do have a client with an acute GI complication, it's true that you don't want to give them solid foods. You want to be really gentle, start them with clear liquids, especially if you aren't yet sure whether they're having a GI bleed or not, because anytime you put anything in their mouth, it's going to send more blood to the intestines to digest that food, and that could worsen this problem. So although a clear liquid diet would be appropriate for someone who does have a GI issue, this guy, I'm not putting anything in his mouth. He's so nauseous he's about to vomit, and he's on now hour 4 of vomiting. He's going to get dehydrated. So I'm not going to start a clear liquid diet. I'm going to keep him in PO. This is not anticipated. And then administering antibiotics. Yes, behind that lumen of the diverticulum, we've got swelling, inflammation. This is the GI tract. It's filled with bacteria. Yes, I'm going to anticipate giving IV antibiotics. IV ondansetron, this is Zofran. He's nauseous. This is indicated. I don't want him vomiting anymore. And then giving continuous IV fluids. We already discussed how elderly clients with vomiting like this are really at risk for dehydration. We want to replace some of that lost fluid. So yes, this is anticipated. Hydrocodone PO PRN for pain. We did decide that we want to treat his pain, but again, we're going to make the problem worse if we put something in his mouth. So this is not anticipated. He is in PO. Placing a nasogastric tube to low suction. Yes, we want to decompress the stomach, relieve that pressure on the GI tract, and then also help make him a little bit more comfortable since he's vomiting. So I do anticipate a nasogastric tube. And then transfusing packed red blood cells. This isn't something that we expected to do for just diverticulitis. If I'm not sure, I can review my lab data again where I have a normal hemoglobin level. He's not anemic. So although he has some blood in his stool, even if he's actively bleeding, you don't give blood just kind of randomly. You give blood when it's really indicated, when their hemoglobin is low, when they're anemic. So this is not anticipated. And we answered this correctly.